Right now, 1 in 3 men over 50 is walking around with a prostate problem that is quietly destroying their quality of life, and they have absolutely no idea. Curious. Think about your last week. Did you wake up at 2 a.m. to use the bathroom? Maybe 3 a.m. too? Did you stand at the toilet and wait, and nothing came? Or maybe it did come, but in a slow, weak trickle that left you wondering what happened to your body? Sighs. You told yourself it was just age, just too much coffee, just stress. But here is what nobody told you. That weak stream, that urgent midnight dash, that feeling that your bladder never fully empties, those are not normal. They are warning signs, and your prostate is at the center of all of it. According to the American Urological Association, more than 50% of men in their 60s and up to 90% of men in their 70s and 80s have symptoms of benign prostatic hyperplasia, that is the medical term for an enlarged prostate. And a massive portion of them are suffering in silence because they are too embarrassed to bring it up, or they genuinely do not know something is wrong. And that is exactly what we are going to break down today. I am Dr. Lena, a board-certified urologist with over 10 years of experience, and I have treated more than 5,000 patients, many of them with this exact problem. If you are new here, subscribe now, because every week I break down the things your doctor does not have time to explain in a 10-minute appointment. Most men have no idea where their prostate even is until it becomes a problem. Your prostate is a small gland, roughly the size of a walnut, that sits directly below your bladder. It wraps around your urethra, that is the tube your urine travels through to exit your body. When the prostate grows, it squeezes that tube. And when the tube gets squeezed, everything downstream gets affected. Here is the part that shocks most people. Your prostate never stops growing. It grows during puberty, then slows down, then starts growing again after age 25, and it never ever stops for the rest of your life. One of my patients, I will call him David, 58 years old, a contractor came in convinced he had a bladder infection. He had been waking up 4 times a night for almost 2 years. He thought it was just aging. In under 10 minutes of examination, we confirmed BPH, an enlarged prostate that had been silently growing for a decade. But here is where it gets really scary. Even men in their 30s and 40s can start experiencing early symptoms and dismiss them entirely. By the time you notice, the problem has often been building for years. Here is what most men do. They Google their symptoms, self-diagnose a UTI or dehydration, drink more water, and move on. That is one of the most common mistakes I see. The symptoms of BPH are eerily similar to a dozen other conditions. A weak urine stream. A feeling of incomplete emptying after you urinate. Urgency, meaning you have to go right now and cannot wait. Nocturia, that is waking up 2 or more times per night to urinate. And hesitancy, where you stand there and it takes a long time to even start. A study published in the European Urology Journal found that men with lower urinary tract symptoms reported significantly lower quality of life scores than men without them. Not just physically, mentally. Relationships suffered, sleep suffered, work performance suffered. I had a patient early 50s, a teacher who told me he stopped going to his son's baseball games because he was afraid of not finding a restroom in time. That is what untreated BPH can quietly steal from you, and most doctors will never tell you this. But the emotional and psychological impact of BPH is just as real as the physical one, and it is almost never discussed. Here is the part that surprises almost every patient I tell this to. If BPH goes untreated for long enough, it does not just stay inconvenient, it becomes dangerous. The pressure backup from a constantly obstructed urethra can damage your bladder muscle over time. That muscle, which is supposed to contract powerfully and fully empty, starts to weaken and stretch. Eventually, it can stop working properly altogether. In severe cases, men develop urinary retention where they physically cannot urinate at all. This is a medical emergency. The bladder can hold 400 to 500 milliliters of urine normally. In acute retention cases, I have drained bladders holding over 1,500 milliliters. That is more than 3 times the normal capacity. The Journal of Urology has documented that men who delay treatment for symptomatic BPH are at significantly higher risk for bladder dysfunction that may not fully reverse even after the prostate issue is addressed. One of my most memorable patients was a 67-year-old man who had been managing symptoms for 6 years on his own supplements, habit changes, nothing prescribed. He came in unable to urinate at all. We placed an emergency catheter that night. His bladder had already begun to show early signs of permanent overstretch. This next part is what shocked even me when I first encountered it in residency. Untreated BPH can also increase your risk of urinary tract infections and kidney damage, because urine that cannot fully drain becomes a breeding ground for bacteria, and that bacteria does not always stay in the bladder. This is the section most men wish they had seen 20 years earlier. Your hormones are the single biggest driver of prostate growth, specifically a hormone called DHT dihydrotestosterone, which is a byproduct of testosterone. As men age, the balance between testosterone and estrogen shifts. Estrogen levels rise relative to testosterone, and research suggests that this hormonal imbalance actually accelerates prostate tissue growth. According to Harvard Medical School, men who are obese have higher circulating estrogen levels, which correlates with increased BPH severity. In fact, metabolic syndrome, the combination of high blood sugar, high blood pressure, excess belly fat, and abnormal cholesterol, is now considered a major risk factor for BPH progression. A patient of mine, 52, software engineer, sedentary lifestyle, pre-diabetic, came in with moderate symptoms. We ran a full metabolic panel. His insulin levels were through the roof. We referred him to an endocrinologist. He addressed his metabolic health, and within 18 months, his prostate symptom score had dropped dramatically without any prostate-specific medication. But here is the piece that will genuinely surprise you. Alcohol and caffeine are not just irritants. In men with existing BPH, they actively worsen symptoms by increasing urine production and irritating the bladder wall, making that urgency and nocturia dramatically worse at night. Here is the conversation I wish every man over 45 had with his doctor, but most never do. There are 2 primary tools we use to screen for and monitor prostate issues. The first is the PSA blood test prostate-specific antigen. This is a protein produced by prostate tissue. Elevated levels do not automatically mean cancer. In fact, BPH itself raises PSA, but trends over time tell us a lot. If your PSA is creeping up year after year, that is clinically important information. The second is a digital rectal exam. I know, nobody's favorite topic, but it takes less than 60 seconds and gives your doctor direct tactile information about the size and texture of the prostate. Skipping it because it is uncomfortable is one of the most medically costly decisions a man can make. The American Urological Association recommends that men begin discussing PSA screening with their doctor at age 40 if they have a family history of prostate cancer or are of African American descent, a group with statistically higher risk. For average risk men, that conversation typically begins at 50. I cannot count how many patients have walked into my office and said, "My last doctor never mentioned any of this." That is not blame, it is a time problem. Primary care appointments average 18 minutes. There's not always room for preventive urology, but here is what I want you to take away from this point. You do not have to wait for symptoms to get serious. You can ask for this conversation proactively starting today. Let us talk about 2 of the most dangerous myths I hear in my clinic constantly. Most people think that if they had prostate cancer, they would know it, that it would be painful, obvious, hard to miss. But the truth is that early-stage prostate cancer almost never causes symptoms. It grows silently. The symptoms that bring men in the weak stream, the urgency, are almost always BPH, not cancer. And ironically, because men assume if something was really wrong, I would feel it, they delay screening entirely. That delay is exactly when early-stage cancer becomes late-stage. Most people also think that an enlarged prostate means cancer. I hear this one constantly, and it causes men to avoid even getting examined out of fear. BPH is not cancer. It does not increase your direct risk of prostate cancer. They are 2 separate conditions that happen to affect the same organ. Having BPH does not mean cancer is coming, but it does mean your prostate needs attention, and the only way to know what you are dealing with is to actually get checked. Here are 5 specific things you can do starting today. Step 1. Track your symptoms for 2 weeks. Download the IPSS International Prostate Symptom Score Questionnaire. It is free, it is publicly available, and it takes less than 3 minutes to complete. Score yourself honestly. Bring that score to your next doctor's appointment. It immediately moves the conversation forward in a productive direction. Step 2. Cut evening fluids by 7 p.m. This does not fix BPH, but it significantly reduces those nighttime wake-ups that are destroying your sleep. The goal is not dehydration. The goal is timing. Drink your fluids earlier in the day. Your nights will improve, sometimes dramatically, within days. Step 3. Reduce alcohol and caffeine after noon. This is the step most people skip, and it is arguably the most impactful for symptom management. Both substances increase urine production and directly irritate the bladder. Cutting them in the afternoon and evening is a genuinely meaningful intervention, not just a vague lifestyle suggestion. Step 4. Get a metabolic health check. Ask your doctor to check your fasting insulin, blood glucose, blood pressure, and lipid panel alongside any prostate screening. Metabolic syndrome drives prostate growth. Treating metabolic dysfunction is treating your prostate health. Step 5. Have an explicit conversation with your doctor about prostate screening. Do not wait for them to bring it up. Say the words, "I want to talk about my prostate and whether I should have a PSA test." If you are over 50 or over 40 with a family history, this conversation is overdue. And if your symptoms are already moderate to severe, meaning you are waking up more than twice a night, you have urgency that affects your daily life, or you have ever had difficulty starting or stopping urination, do not wait. See a urologist. Before I go, there is one more thing about the prostate that almost nobody in the general public knows, and it genuinely surprised me the first time I read the research. Studies have shown that regular sexual activity and ejaculation, specifically higher ejaculation frequency in men in their 40s and 50s, is associated in multiple large-scale studies with meaningfully lower rates of prostate-related issues over time. The Journal of the American Medical Association published data from a cohort of nearly 30,000 men followed over 18 years. Men who ejaculated more frequently had statistically lower rates of prostate disease in follow-up years. Nobody brings this up, not in waiting rooms, not in routine checkups, but it is peer-reviewed, repeated across studies, and clinically relevant, and you deserve to know it. Let me leave you with 3 things to remember. 1. BPH is common, progressive, and treatable, but only if you actually address it. Ignoring symptoms does not make them go away. It gives the problem more time to cause damage. 2. Your symptoms are data. Track them. Quantify them. Bring them to a medical professional. Do not normalize discomfort just because it crept up slowly. 3. Early screening saves lives and quality of life. PSA trends over time and a simple physical exam are not dramatic, but they are some of the most powerful tools we have. Subscribe, because I release new videos every week covering exactly what your doctor does not have time to tell you in a standard appointment. And if this video surprised you, you absolutely need to watch this video next.